Bladder cancer is a disease that, like many others, can benefit greatly from early detection. Although often overlooked, the way a person urinates can provide crucial signals for identifying the early symptoms of this condition. Hematuria, or the presence of blood in the urine, is the most common symptom and the one that most frequently leads patients to seek medical attention. However, Dr. Enrique Grande, head of the Medical Oncology Service at MD Anderson Cancer Center Madrid, warns that it is not always present and that other signs may indicate the possible presence of a tumor in the bladder. Symptoms such as burning during urination, frequent urges to urinate, the feeling of incomplete emptying, pelvic pain, and changes in urinary habits can all serve as early warning signs of a disease. One of the most concerning aspects of bladder cancer is that, in its early stages, it may not cause any pain or noticeable symptoms. This can lead many people to ignore warning signs like hematuria, especially when it is not persistent. The testimony of Laurent G., a bladder cancer patient, illustrates this danger. He noticed a slight pinkish tint at the end of urination, but since it was not a constant symptom, he hesitated to give it much importance. Eventually, he decided to visit a doctor and was diagnosed early, allowing treatment to begin in time. His case highlights the importance of paying attention even to subtle changes in urination and not waiting for more severe or debilitating symptoms before seeking medical help. Dr. Grande cautions that the presence of blood in the urine does not always indicate bladder cancer. Many other conditions can cause hematuria, including urinary tract infections, kidney stones, autoimmune diseases, blood clotting disorders, or even physical trauma. However, this does not mean the symptoms should be ignored. Since bladder cancer is a possibility, anyone who notices blood in their urine or experiences persistent changes in urinary habits should see a specialist for a thorough evaluation. Ignoring these signs could delay diagnosis and reduce treatment options. Early detection is key in the fight against bladder cancer. According to Dr. Grande, when the disease is detected in its initial stages before it spreads to other parts of the body, the chances of a cure are significantly higher. In cases of superficial bladder cancer, where the tumor is confined to the inner lining of the bladder, treatment options can be less invasive and highly effective. Procedures such as transurethral resection of the bladder, TURBT, have shown success rates of around 80 to 90% in terms of long-term survival. This means that individuals diagnosed at an early stage have a real chance of overcoming the disease with timely and appropriate treatment. The situation becomes more complex when bladder cancer is invasive and has penetrated deeper layers of the bladder, including the muscle. In such cases, the long-term survival rate drops to around 50%, emphasizing the importance of early diagnosis. However, medical advancements have introduced new treatment options even for more severe cases. The combination of chemotherapy and surgery has been an effective strategy for many patients, and immunotherapy, which has recently been added to the therapeutic arsenal, is showing promising results by enhancing the immune system's ability to fight cancer. Bladder cancer remains a challenge in oncology, but awareness and knowledge of its early signs can make the difference between a manageable condition and one that is detected at an advanced stage with fewer treatment options. Monitoring urinary habits is a simple yet powerful tool that can save lives. The key is to pay attention to the body's signals and act quickly if any unusual changes occur. Thanks to advancements in diagnosis and treatment, the outlook for bladder cancer patients has significantly improved, and with early detection, the chances of successful treatment are higher than ever.